very much. Well, firstly,
sorry.
No problem at all. So firstly, I'm going to share my screen, hopefully. Right. I'm going to reduce you all. So apologies, from this point onwards, I won't be able to see you. So Natasha, if there are any questions, please do let me know and I can go from there.
I will do.
So I'm starting with the disclaimer. As Natasha's fully aware, we are doing this every single time at the moment. These slides were last updated on the 22nd of January. And as you'll see, there's a really good reason why we have been putting in this disclaimer at all times, because everything is changing consistently. CQC are adding more guidance. The one thing that I will say at this point in time is that a lot of the time when CQC are adding to their guidance or amending their guidance, it's not actually obvious from the website that they're doing that. And we have a couple of alerts, for example, put on our system to be able to say when we think that a particular website page has changed, but we're not always getting those announcements through. So I'll do very quickly a recap from the last webinar. I am aware, and thank you very much for highlighting it to me, that there are a few people that weren't at the last webinar. Hopefully most people have the kind of background of where we are in terms of what the significant changes are, but we'll go through that very quickly. And then we'll go through the important things that we consider are necessary for all providers to understand. And those are listed there. And again, I understand that Natasha is going to be sharing that. Well, as hopefully we all know, the CQC single assessment framework rollout has begun. So we initially had a number of early adopters, and from the 5th of December, all in the South region, from the 9th of January, London and the East of England, albeit I would say we're seeing significantly fewer of our main provider clients than we had thought already going through the process. So it may be that we're already seeing those quite foreseeable, I have to say, delays in those processes. Then from the 16th, we understand they were rolling out to the North and the Midlands. And then from next month, all North and Midlands. And then again, from the 6th of February, applications to register new activities will be used, will be assessed using the new approach. Again, if anybody has any questions about registering a new activity or a new service, please do let me know at the end, because there are some complexities about that process that aren't being covered at the moment. But we do know that quite, I would say understandably, CQC seem to be delaying some of their registrations at the moment on the basis that they are intending to register under the new system rather than having a bit of a hybrid process at the beginning of 2024. We have a number of changes in terms of the actual structures. The most important is that you no longer just have inspectors. And in fact, the argument seems to be that the inspectors are the lesser of the two new roles. So we have inspectors, they're the ones that will physically do the in-person inspections. They're the type of people that you've seen before, come in to your offices, look at your software, speak to people. But we also now have assessors, and assessors appear to have that primary role. So assessors are the people who are looking at the information in the background, will arguably looking at the information from the portal, more on that in a second, and that they will be able to make decisions in terms of ratings, whether or not there has been an in-person inspection. I cannot stress that enough. This is not a system that relies on you only having a change of rating when somebody comes through your door. There can be a change of rating based purely on the physical evidence that they have in front of them, and or picking up the phone to, for example, third-party professionals looking at your surveys, etc. So when it comes to the importance of digitization and understanding your software and being able to effectively communicate the quality of care that you provide through your software, this is going to become so much more important, which is why Sussex Digital and Reach team and others are absolute godsends to providers, because we understand that assessors are going to, at some point in time, want to access certain aspects of your software remotely. And you need to be able to have confidence in your software that they will be able to do that, because of course a lot of the time the criticisms that we've previously seen from providers is that of
Nicole, you're breaking up there. We can't hear you.
software. No,
There we go. You're back.
I'm back.
You're back. You're just that
Oh
last
dear.
3 or 4 seconds.
Okay, sorry. What I was saying was, in terms of best practice for using your software, we have seen situations previously where people had brilliant software. They've attempted to share it with their inspectors. Their inspectors have said, I don't know how to use this in a digital version, print it off for me, but then of course don't understand the nuances of it or how everything integrates together. The theory is that under the new system, not only are they going to be prioritizing the use of this kind of software for many reasons, but equally that they will be able to use it themselves. So there should no longer be the excuse of the fact that, well, printing things off in tabs no longer demonstrates the nuances and the easy use of a system. So in terms of the new provider portal, it would be really interesting at the end, and maybe in the chat function, to tell me if you have received an invite to the new provider portal. The theory was that CQC would not be able to use its new inspection framework unless you were using the new portal, because of the emphasis on assessors being able to use the software and being able to pull things out from the provider portal. We know that hasn't happened. We know that very, very, very few people of the percentage that we would expect to see have received those invitations, and of those that have had inspections, many of those actually have not received an invitation. So they are being inspected under the new protocols, the new framework, but not with access to the portal at the moment. And so they are still relying on having that physical evidence. The theory is that by the end of 2024, all existing service users should have been invited to the new portal. Given the uptake that we've seen and the number of invites that we've seen so far, that doesn't look like it's feasible, but maybe there's going to be a push in the next couple of weeks for that to be the case. What I would say, however, is please make sure that all of your contact details are up to date with CQC. So your registered manager, your nominated individual, your provider details, because those invites are going to be going to the contact details on file. And if they don't receive a response from you, they are going to assume you haven't taken it up rather than that they have the details from. This is the part that I hope everybody knows about already, in that this is what the new single assessment framework looks like, with the significant caveats that actually it turns out it's not a single assessment as it was initially considered to be. Again, sorry, more details of that in a minute. There's quite a lot of information to get through. So our 5 key questions: safe, caring, responsive, well, are all still there. They're no longer called domains, they're called the 5 key questions. The Chloes have gone. There is no longer the key lines of inquiry, and correspondingly, there are no longer the ratings characteristics for key lines of inquiry. If you have any systems at the moment or any best practice preparation for your inspections that involve the Chloes, get rid of them now. We now have the quality statements that are the we statements, and then underneath that we have the I statements.
Nicole, sorry, Nicole,
yeah.
Are you going through the slides at the moment?
I am, yeah.
Okay, they're not moving for us. We're still on the first one.
Oh, right. Okay, that's not ideal. I'll stop sharing screen. Can you just see me now?
Yes.
Okay. Sorry about this, everyone.
Would you want to try again, Nicole? And then if it doesn't work, I'll try from my end.
Yes, that would be very useful. What can you see now?
Still you.
Okay, less than ideal. I'm so sorry. This did work in a practice run earlier this morning.
Oh, don't you love it?
Indeed. Okay.
Okay, so you're on slide 6 now, is that correct?
Yes, that's correct. Can you see a little triangle table?
Yes, we can see single assessment framework, our assessment framework. Yes, we can.
Perfect. Okay, so really sorry about that. Natasha will be sharing the slides with you, but what I've said so far didn't have any kind of significant showy aspects of it. This is your new system, however, as I said, the Chloes have gone. Your quality statements are effectively your new Chloes. So they are the benchmarks against which you should be doing things. So you have your 5 key questions, they're your domains, which are aligned with the I statements. And then you have your quality statements, which are aligned with the we statements. All of those are available on the CQC website, but rather than there being effectively hundreds of them, if we're talking about those subheadings of the Chloes, we now only have 34 of those. Underneath that, you have your 6 evidence categories, and we'll go into those in more detail, but they are people's experience, feedback from staff and leaders, feedback from partners, observations, processes, and outcomes. Now, like with the Chloes and the old assessment framework, CQC isn't under any obligation to test against all of those. We'll go through a couple of worked examples in a second as to what that looks like in practice. Then underneath that, you have your specific evidence and quality indicators, and they are how the single assessment framework is tailored to your specific type of area. And then underneath that, we have the best practice standards and guidance. Only some of that has come out. I cannot stress how much it's important that you go through what that will look like for your specific area.
Nicole,
because it is
sorry to interrupt you. It doesn't look like we're actually watching live slides. It looks like the preview's still on. We've had some messages. Sure, it's kind of, we're seeing the line up down the side of slide 6, 7, 8, and then it's like a preview setting.
Oh, well, that's not even what I see. So that's right. Okay.
So we've moved on to the next slide now. We're on slide 7.
I'm so sorry, Natasha. Could I please change to you?
Yeah, sure.
Sharing,
we'll see if we can
not
set it up from my end. So if you want to stop sharing, I'll try and do mine.
Yeah.
Someone's saying you need to press play the slides.
Oh, that was what I was on previously. I was on play, and that was what apparently froze.
Oh.
Oh dear.
So do you want, shall I try from my end?
If you could do, that would be brilliant.
And then can you see slides now from me? So where do I press play?
If you go down to number 6, I suppose, and click on it. And then slideshow. Thank you, Danny.
Slide.
Yes.
Slideshow. What does it say? Oh, look, I'm going completely
above home on the top.
Slideshow.
From the current slide.
There we go. Can we see that, everybody? Can you see that, Nicole?
I can see it.
Yeah, everybody can see that. That's fine. So what do I need to press to move on? Do I press enter or something to get it onto the next?
Press the arrow. If you have an arrow, and press right on the arrow.
Okay. Thank you.
And I should No, thank you. Unfortunately, it's a bit interactive, which is why I had hoped I would be sharing it. But yes, if you could just click the arrow, it should bring up, yeah, those.
Do you want them all up?
Please. And then if we can, yes, no, perfect. I'm going to say it. Next slide, please. So, in terms of evidence gathering, we know that feedback has now been put as a fundamental new assessment area. We know that they were already seeking feedback, but that has been significantly prioritised. More importantly, I would say than that, because hopefully that is a system that you have already been doing to an extent, is the fact that there are new assessment areas. So we have workforce wellbeing and enablement, which is under caring. We have environmental sustainability and sustainable development, which is under well-led, albeit CQC have told us that they aren't going to be testing against that for the next few months. Again, watch this space. And workforce equality, diversity and inclusion are those new areas. In terms of the existing ratings, they do align to what they did previously. So outstanding is 4, good is 3, requires improvement is 2, and inadequate is 1. So that is, they are still effectively the same. Now, in terms of the first scores, Natasha, if you could go to the next page, and if you can, I think you'd click 3 or 4 times in terms of the number of arrows that will come up.
Doing well, aren't we, today? So much for a digital team because
I know.
Zoom to work. Is that the one?
Yeah, that's the one. And if you can click on it, I think 3 times, 4 times, there are some arrows that are going to come. 1 more. Perfect. Thank you. Okay. Oh, sorry. 1 back. Yeah. So these are the first scores based on examples. So if hypothetically in this situation, we had green being those that are being tested for new, and yellow, orange being those that were relying on the previous examples, please note that certain of the aspects that you would have recognised under the Chloes have changed. So care provision, integration and continuity has moved from well-led to responsive. Providing information has moved from effective to responsive. Environmental sustainability won't have a score at all because that's new. And workforce wellbeing and enablement has moved from well-led to caring. Now, this is important because what CQC are doing, in their words, is they are porting over the old ratings for your particular domain, now key question, into certain things. So if your safe requires improvement, and this time around they don't rate you against any of the aspects of safe, then safe can only be a 2. Likewise, effective, if you were good, you can only be a 3. However, interestingly, if your well-led requires improvement, but your caring was good, they, Hannah, yes, you will definitely get a copy of the slides. They will port over the number 2, so the requires improvement, from your well-led into your caring. Again, we're going to go through the examples for that, but you see how these can potentially change your ratings or have an influence on your ratings even before any assessor has logged on or any inspector has logged through the door. So next slide, please. Following on from that, in the next slide, we see that it's in relation to reaching a rating. CQC is going to give a score for each of the evidence categories, and each of the evidence categories and quality statements are weighted equally. Again, this is important because whilst each of the 5 and again, we'll go through the example, the ultimate score for each of the 5 will be considered as part of the average as it would have been previously. However, because different evidence categories are going to be updated at different times, there could be a really significant lag between when your last inspection under the old framework happened and when the rating from that inspection change at any point in time in your new rating system. So again, in relation to the next slide, for example, so if we go to the key question of safe, and in that scenario, we have the 4 evidence categories that they will look at. So it's people's experience, feedback from staff and leaders, observations and processes, observation and processes. So in relation to this, they've updated those. So in this scenario, you were a good, so you were a 3. However, they have looked at 3 of those categories, but they haven't looked at processes. And they've considered that feedback from staff and leaders is actually at the level of a 2, which aligns to requires improvement. So this changes from people's experiences as 3, feedback from staff and leaders is a 2 now, observations is a 3, processes is 3. Now that gives you an 11, because that's 3 plus 2 plus 3 plus 3. If you move to the next slide, how does CQ then transport that back into the system? Well, what they do is that they take that overall score of 3, they calculate it as a percentage. So I'm so sorry, if you could just keep clicking through the arrows, calculating through a percentage equals 69%, and then that calculates back to a score, which is 3, which keeps you at a good. Now, this is again in relation to the key question of safe, and they've assessed those particular aspects of it, but they've left 1. So in our scenario, you were a good, the processes therefore stays as a good because it's the only one of the evidence categories that wasn't assessed against, and therefore it's going to remain at that point in time. Now, if we can go over to the next slide, for example, if you have a scenario where only one of the quality statements is going to be assessed, but you're in a system, and we're assuming in the system that you've had more than one inspection under this framework, theoretically, where only one is updated, actually it doesn't have a huge amount of effect on your overall key question score, because you're just moving from a 2 to a 3, or from a 4 to a 3, for example. So when you're actually doing the averages, it doesn't change a huge amount. But the existing scores that CQC choose not to assess will remain the same, and we haven't been given any guidance as such as at the moment about why they would be making certain decisions about what to assess and what not to assess. So if we can again work through the example, we're going to get onto rating limiters in a second, but if CQC update that 3 again in those circumstances, then all we're going to be doing is combining out of the 32. The change, as I said, of 1 is not likely to change the percentage. So you're going to need CQC to be making an active decision to to assess a number of the quality statements to have any likelihood of affecting any of your key questions. And again, if we can go to the next one, that's why it's important. And thank you for the question. I'm going to go on to that in a second. Because, oh, sorry, back. What? Yeah, no, sorry, back one more, apologies. There should be one that says limiters in the title. Maybe it's the next one over. Could be the next one. Oh dear, right, I'm glad I have a copy of this in front of me.
There we go, I've got limiters.
There we go, fantastic, right. So Limiters is the most important thing that you really, really need to know about in terms of what to challenge, when and how. The question was about whether or not you're going to see a breakdown of the scores. The answer is yes, we think so, because they have done in terms of at least one provider that we know about. However, those breakdowns are not published. So we only know of one provider where they have been provided that breakdown. And actually, in terms of the factual accuracy process, which we'll very briefly get onto, because we have no testing for it at the moment, that is going to be absolutely necessary because of this, because the limiters are there in terms of the fact that if you are in the good range, but there is a score of 1 for any of the quality statements, then the rating is automatically requires improvement. If you're in the outstanding range, but you have a score of 1 for any of the quality statement scores, the rating is limited to good. That applies to the key question and it applies overall. However, CQC have said where they consider that the 1, or in this case, if it's outstanding, the 1 or the 2 is an outlier, they can apply their discretion to amend it. We have no information at the moment to suggest how it is that they are likely to do that. So if I can just go to the next slide to show you the practical example of how that works. So in this scenario, we have the key question of safe. In this scenario, they have rated at least one of the quality statements, and one of the quality statements that they have looked at is learning culture. If they have looked at learning culture and they have found actually what we have just seen is inadequate, we will score that as a 1. With every other score that they've got, even if they are the updated scores or the existing scores, you will come up with a percentage of 75%. Now that is, as you can see from the box on the right-hand side, very, very comfortably within good. However, it's not. And the reason it's not is because there is a score of 1 as a quality statement. And that is, as we understand it, a black and white rating limiter, unless you can ask CQC to exercise their discretion. The converse way of looking at that is that actually CQC have come in, you were previously inadequate, but they didn't rate you since before the pandemic, for example. You've done all of this absolutely amazing work. They look at all of your quality statements bar 1. In every single scenario, you will never, ever get a good or an outstanding. That seems to be the most concerning thing that we are aware of in terms of the practicalities of this system at the moment, because the way in which the maths works means that where they are retaining a score, if you were inadequate, you are never, doesn't matter what else is going to happen, be anything other than a requires improvement. If you were a requires improvement, on the assumption that they will not be rating all of the quality statements at the same time, and they have said that they won't, not least quite understandably because of capacity, if you were a requires improvement, you will never ever be anything other than a good under this new system, unless CQC choose to exercise their discretion. And as I said, we don't have any information in relation to how they will do that. So in terms of the next slide, reaching a rating, what will they do? So each service will receive an overall rating, we know that. Each service will receive a key question, each key question will receive a rating, albeit some of them will be reliant upon the previous rating system. Each key question will receive that percentage score, and then the quality statement will receive a score on the scale of 1 to 4, which aligns with the inadequate to outstanding. So in terms of the next slide, we know that, as I said, the 5 key questions we are told are equally important in this. And again, we know that there are We all know that there are rating limiters involved in this, but we also know that there is an element of exercising of discretion. In terms of what that discretion looks like, that's on the next slide. So it says if they identify any concerns in relation to an assessment, they'll use their professional judgment to decide whether to depart from their ratings principles. This will be particularly where we need to aggregate ratings that range from inadequate to outstanding. One of the questions was, will we receive that information? As I said, we don't know if you're going to receive the full information in relation to the breakdown of quality statements, but specifically, we don't know if you will be told where CQC are going to be exercising their discretion. Because of course, in the same way as you see the adverts on TV for assessing, that discretion could go up or down. We don't know which way it will go. We do, however, have some indications from the first single assessment framework inspections that have been conducted. And both of those were in-person assessments, and they are on the next slide. And there should be links to those available to you. Now, in relation to both of those, they were both home care agencies. They were both based in Bedfordshire. They were both assessed, so on the papers in the portal, albeit we don't believe either of them actually had portal instructions, and inspected. And in every key question, they were considered to be good, and overall, they were considered to be good. So if we look at what the breakdown looks like, which is in the next slide, the actual product that you get is different. So unlike on the system where it's a PDF that you could pull it out previously, this is an on paper, on website page, document. Each key question has more detail on it. The statements are identified. The score out of 100 is identified. The quality statement is listed against the score, which is different, of course, because previously you didn't have that level of breakdown in terms of what it was they're looking at in terms of the Chloe's, for example, if we're looking at it under the old system. And the quality statement that was assessed is briefly described and the outcomes discussed. However, we do know that over the period of this first process, they are going to be adapting the system. So the way in which the reports look now is not necessarily the way that the reports are going to look in future. So on the next slide, this is what it looks like at the moment. So this is, if you went into that particular, obviously we've anonymized them, but they are, to be fair, relatively easy to find because a lot has been written about them by people like us. This is what your new statement will look like. One thing that I would like to point out to you, I was about to point to my screen, that doesn't help anybody, is that under the overview, it says latest assessment, 11th of November 2023, report published 5th of January 2024, latest review, which was that previous desktop review that everybody was getting, 6th of July 2023. And that is important because of what happens next. So if you can go over to the next slide, please. That's going to that has this breakdown on it here. So the hyperlinks go to the narrative score. I haven't included the hyperlinks on here. And then there's a brief overview of the service, which is under our view of the service. And it shows where the overall and key question ratings are, and they are again hyperlinked and you can break down to it, but it only has that kind of brief narrative. And again, it has to demonstrate how important it considers the feedback to be. People's experience of the service is the second block down at the moment. Now, if you go to the next slide, please. If you can, sorry. No, oh yes, you're right. Go back to the next one. Sorry, it's just yeah. And then if you can click 1, 2, 3 times, I believe. There we go. That's amazing. The report says but this is the report from the 11th of November 2023. If you are a member of the public, if you are a future service user, if you are a family member, you are going to look at this and say, this is a report from the 11th of November 2023. This is the snapshot on the date. This is the material that was available. This is the information that they gathered on the day. However, we have provided for you what they have actually tested against, which is in green, and what they have not tested against, which is in red. It says we did not look at this statement, but it doesn't tell you when all of that information was gathered, and it doesn't say on what basis they came to the previous statement, how long ago it was, etc., etc. So the report being published 11th of November 2023, but it not being potentially immediately obvious when the information was gathered previously, we would say could cause some issues. Now, in this case, whilst we've anonymized it, as I said, it's relatively easy to find. This service was last inspected in October 2017. If anybody wants to do the maths there.
Yeah, 6 years ago.
Yeah, it was over 6 years ago. So the information that they have on the basis of all of those quality statements that they are not inspecting is over 6 years old. And unless somebody's going to go into a deep dive of the previous inspection reports, that's not obvious, because of course all they have had beforehand is the previous desktop review that said we found no reason to change what you'd previously done. So again, if we can go to the next slide, and I think I've got 2 clicks at this point in time. So you have your updated rating, you've got your report from the 11th of November 2023, and you've got your score of 75 out of 100 from this area. And again, in terms of, sorry, if you can click, I think it's, yeah, one more time, all of those scores were previously good. And thank goodness for that. Because if they weren't, there is no mathematical way that the last time that this provider was inspected in October of 2017 could have resulted in a good score this time round. That is going to be really, really important for a number of reasons. We know that the assessor is taking priority over the inspector. So when you are asked to provide your evidence through the portal, which you will be at various points in time, provide information that you consider sits in a lot of different slots. So for example, environmental sustainability, if you are really proud of the digitization of your system, share that in terms of your responsiveness, share that in terms of how good you are at being able to aggregate and analyze feedback and incident trends and audits, and also how it's great for environmental sustainability, and feed that information to them to say, I would be saying, we don't know what the feedback or what the format of this is going to look like, but effectively a kind of cover sheet saying, this is the information that you've asked for. We consider that this demonstrates this WE statement, this ICE statement, this quality statement, because you don't have, as far as we can tell, any ability to engage with CQC as to what quality statements they choose to assess. And so we say, at least until we get some good guidance out, and that's not going to be for at least 6 months, throw everything at the wall, really understand what your I and we statements look like, and really understand where your evidence of good practice and your evidence of best practice really, really sings. Now, I appreciate I'm slightly behind time, so if we can go on to the next slide. This slide, it can only be taken with the most massive wedge of salt, because this is what we understand to be CQC's focus areas based on the very, very limited amount of information that we have at the moment from the new inspection. So under safe, they've really concentrated on involving people and managing risk, safe and effective staffing, and safeguarding. In relation to caring, independence, choice and control, and in relation to responsive, equity in experiences and outcomes. That is the data that we have gathered from those that have been inspected and where reports have come out. However, we know providers who have been inspected and many more quality statements have been prioritised, and those in-person inspectors have said, yes, they're important to us, but also so is X, Y, and Z. So this is in no way binding. It's just everybody scrabbling around for clues as to what it might be at the moment. So that's where we are. So again, in relation to the next slide on the practical effect of this, well, if we know that safeguarding, involved people in managing risks, and safe and effective are going to be the things that are tested. If you were previously a requires improvement, oh, sorry, can you click twice, please? If you were previously a requires improvement, but you are now inspected under what they are considering to be their priority areas if we are taking this very, very limited sample. If you previously requires improvement, and that was your October 2017 inspection, for example, and they only inspected those, which is what we did in the example that we just saw, you can't be better than requires improvement. And that has nothing to do with the rating limiters. That's because if they only have those 3 statements that they inspect against, and only those 3 therefore move up the dial from a 2 to a 3, you're still in requires improvement territory. You would need to have 1 more inspected to be able to move the dial up to good. So this is something to really look at and to really consider, because again, arguably in terms of the factual accuracy process, we say, well, you say you didn't inspect X, but we say actually you did inspect X, and that's another quality statement. And on that basis, we would say that you can add an additional change to it, and therefore X, Y, and Z, and it should be a better rating. Again, it's simply us trying to work through the scenarios of what things look like at the moment. The next slide is our understanding of what the factual accuracy process actually looks like at the moment. So it's now called a factual accuracy check rather than a factual accuracy challenge. We know that CQC are going to email you a link to the draft report online. We know that you will have 10 working days to respond. We will have the same sections, albeit we don't actually know what they will look like in practice. In terms of section A used to be typos, section B used to be what you consider factually inaccurate, and section C was additional information was omitted. Interestingly, the opportunity to challenge ratings is part of this. It has always been part of it. CQC's guidance used to be arguably a little bit misleading in that it said, if you want to challenge a rating, you can only do that under a ratings review. What they actually meant was you can't have a second bite of the cherry in terms of challenging factual accuracy under the ratings review, but you must necessarily be able to challenge the ratings, because when you are updating your factual accuracy challenges under the old system, you can say, and therefore if you take away that breach, or therefore you take away that misunderstanding in terms of medical optimization or our audit systems, then we should be good, rather than the requires improvement, which is in the draft inspection rating. We believe that you will be able to request additional information from the inspection notes. Now, again, this is a slight change. I have been in this game long enough to know when you could literally request the entirety of each inspector's notes. Then it went to, you can request specifics of the inspector's notes if you identify exactly what it is that you need. And then it went to, we will not be providing inspector's notes full stop, but we will potentially provide context, although most of the time, unfortunately, they didn't do that. There is now guidance in the new factual accuracy check system, which says, if you can tell us what it is you need the further context from and the notes for, we will provide that information to you. I would, again, because we're flying through this, I would say, please do go onto the website and look at the current guidance, and then save it as a favorite and continue to refresh it every week, because it literally is changing all of the time, as is the ratings review process, which is the next slide. This is where it's under exactly the same test as far as we're aware, where CQC have failed to review their processes in relation to a ratings decision. Again, it's 15 working days, and again, it's a 500 word limit. There will now be a message published on the website to say that a ratings review is taking place. There is significant further information in relation to this on the website. So I've just highlighted a little bit of it on the next page, which is that we understand that if the grounds for a review are met, i.e. if you pass the test for saying that it is where procedures have arguably gone wrong, that's your argument, not necessarily that that's been found to be the case, that the independent reviewer, so somebody that's not involved in the original inspection, will be part of that, and that they will aim to complete that review within 50 working days. Obviously, that's not binding. Interesting process, however, is that we know that if there has been a complaint made, CQC will now pause the review until that complaint is received, which I think is an absolutely brilliant development, because previously they were on completely different train tracks. You can have your factual accuracy process and your ratings review happening, and a complaint happening, but the complaint could be dealt with at a completely different point in time, despite the fact that you needed all of those things together to be able to form really the background to what you are looking at. As I said, in terms of early insights, we really are just scrabbling around to look at what we have at the moment. So the next slide demonstrates what we know so far. So in terms of the fact that inspectors will be invited to select a service, that there will be feedback, evidence and record keeping. We don't know how you're going to demonstrate it, but we know it's going to be important. So again, the digitization of your systems, the easier it is to be able to prove that information, will potentially enhance and ease your ability of being able to go forwards. And I cannot emphasize enough, as somebody who really tried to avoid maths at school, how impossible it will be to avoid the maths for this going forwards. As you'll see when you're working through the examples with the slides afterwards, if you choose to go away and do homework on it, which I really hope you do, because it's the only way to get your head around the systems, you need to be able to do the maths to understand how you change the dial in relation to your different ratings. On the next slide, we have our best guesses at the moment in terms of what providers can do to prepare. So as I said at the beginning, ensure they've got your correct contact details so that you can sign up to the portal. Making sure that you have as much information as possible available to you to download the data from your existing portal if you use it. I know that some people don't, but if you don't, there's no point in potentially getting your head around it now, but that would be really useful to understand what the system looks like. Start introducing those new language, those new terms, the we statements, the I statements, how everything goes together. Your staff are going to need to know that. Your staff are going to be able to speak CQC's language, both in writing in terms of speaking to the assessors and when they are speaking to the in-person inspectors, making sure that your current audit processes and your actions reflect those I statements and those we statements. You will not be able to just copy paste from the Chloe's into the I and we statements. They don't work like that. You also need to understand, as I've said in the very beginning slides, that some of those bits that you were testing have moved around. So if you have one of those beautiful folders that I've seen before in terms of this is what we do under the well-led section, and there may be bits of that you're moving out into caring and vice versa. And so you really need to be able to understand what you're doing, how you're recording it, and how you can use the data that you already have and you're already gathering to fit into these new quality statements. Likewise, on the next page, making sure that you're really engaging with third parties, with families, with service users in relation to feedback. And it has to become a little bit of a different muscle than you're using at the moment. It is not going to be sufficient to just have 1 year surveys. Every single time you're having a team meeting, asking staff if they have any feedback from a social worker that's come in, or a TVN that said they're really impressed with your wound care management. Do you have a document you can send to them? Or even if you don't think they're going to respond to them because they're busy people as well, sending them an email saying, thank you so much for visiting Joyce on Tuesday. We were really delighted that you were pleased that there's been no further deterioration in the wound and that we're following the care plan correctly. Unless you get anything that came back from the TVN saying, that's not what I said, making sure you print that off, you put that in your feedback. This is all organic feedback that you as really busy people will probably be receiving all of the time, and you are not prioritizing it. It needs to be information that you are actively pursuing, actively recording, and then actively storing in the right places. And again, continuing to refresh your CQC guidance. Obviously, we have updates, as you can see here. We have training courses that we're going through all of the time. We have newsletters. My links are in not the next slide, the one afterwards, but in terms of the next slide, we've already gone through what it will look like in terms of potentially 2024. A lot of this is very much watch this space, because we were already having changes in guidance. We're already having changes in best practice. We know, for example, that what they will be prioritizing, the adult social care area, is not what they're going to be prioritizing in the NHS. And they are updating those sector-specific bits of guidance all of the time. So please do continue to look for that. I appreciate that was a massive run through, but if everybody has maybe 5 minutes more to stay on, please do let me know if there are any questions. Natasha, is there anything else that asked? As I said, I haven't been keeping an eye on the chat.
No, just asked if we're going to email them a copy of the recording, but I've explained that it will be uploaded to our website and Facebook page, and a link to both of those will be on the email I send out with the slides. I think you answered most of the other questions as we went through. Is there anybody else that wants? Oh, we've got a new message. Someone said from Karen saying thanks, really helpful. Has anybody
Brilliant,
got anything else they'd like to ask? Either they can speak up now or pop it in the chat.
If you've not been assessed yet, are you in a better place? Well, that's a really interesting question, because theoretically, unless you're already outstanding, yes, you are potentially in a better place if what you're able to do is to follow the new systems to the letter and make sure that all of your systems, your storage, are exactly under the new system, because you're in a better place, because you don't need to adjust from the Chloe's, and you won't be beholden to the previous ratings limiters. However, of course, it works conversely, because you won't be able to rely on any of the kind of helpful 3s from a good rating that would be ported into your new system. But I do appreciate that we've ran through that, because there's so much, and I mean, there's so much more in detail. So if people have specific questions, you have my contact details.
So Karen's also written, we are a new service and not yet been inspected.
And Karen, I assume that you're in the South area, you're in the Sussex area, I would assume from this. Theoretically, you are being inspected in the next couple of months. Now, sorry, there is an aspect of this which is needs led. So if there are concerns, CQC are always going to be prioritizing where they consider they're going to be concerns, and that prioritization, we understand. Again, I cannot caveat this enough, and it's not just because that's a lawyer's thing that we do. We understand that that will take prioritization over new services, but we can't guarantee that that's going to be the case. We do know that if you are in the southern region, you will be inspected under the new process. Will be no excuse whatsoever for you having like Chloe's anywhere near how you're putting in your ratings, and they will be expecting you to be highly conversion in the I statements, the we statements. They are putting a huge amount of pressure on the expectations of new providers, I guess understandably to an extent, but of course you don't have to be a new provider to have not been inspected in person. And again, if you had, as we used the last example, your last inspection was in October 2017, I mean, you could have had a whole scale change in all staff, all management from that point of view. And so it's arguably, it's not reflective, but I think we're going to see a lot of those kinks coming out as we continue.
Thank you, Nicole. Oh, we've got another quick question. Oh, no, great, thanks. Karen's reply.
Oh, brilliant. Okay.
Anybody else got anything before they need to shoot off and finish their day? Doesn't look like it. Well, thank you everybody for attending. From what I can see from the chat, you've all found it really helpful. And as Nicole said, you know, the Sussex Digital team are here to support you. Any further questions, please do get in contact with us. And obviously Nicole's details will be on the slides as well. Thank you for your time and enjoy the rest of your day. Take care.
Thank you so much for the invite, Natasha.
Lovely.
Thank you very much,
Thank you so much, Nicole. Take care. I'll speak to you soon.
Thanks.
Bye-bye.
Bye. Bye.